I'm Scoot. He joins us here on a Zoom interview. Doctor, welcome.
Thank you so much. It's nice to see you again.
You know, the last conversation that you and I had went absolutely viral. And it was because of the information and the way you phrase things. So we just wanted to get back in touch with you at this point after this amount of time and just see where we are.
Okay.
There seems to be a growing divide over whether social distancing is necessary. Does social distancing work?
Oh, there's no question that social distancing has been incredibly effective, not only here, but around the world. I think that the evidence is absolutely clear amongst all public health officials and epidemiologists and people who study this, that social distancing has, without a question, been incredibly effective. And this is really at heart here is that the inherent difficulty in measuring public health outcomes is that if we are successful with our public health measures, oftentimes it's difficult to measure a negative, right? It's hard to measure something that you don't see. And so if we didn't do this social distancing, you would have seen a crush at the hospitals, but we immediately flattened that curve right away. And we never saw that crush in the hospitals that we were expecting last week and this week. So there is no question that social distancing is, without question, the most effective tool in our toolbox right now for conquering this virus.
You know, I just took my exercise walk this afternoon, and I saw several groups of people that, maybe that's one family, but sometimes there's a group of adults together and they're not social distancing. In some cases, they're wearing masks. And doctor, has the idea of wearing a mask given some people a false sense of security?
That's a great question, and I think it has. The last time we talked, the whole positioning on masks has changed significantly, and I had said in the past that wearing masks were not effective. But what we have, and I've changed my tune on that, obviously. What we have seen is that wearing masks is incredibly effective in terms of being able to prevent the spread of the virus. What we're seeing right now, Scoot, is that the U.S. Dr. Redfield, the head of the CDC, last week said that 25% of Americans who tested positive were asymptomatic. Iceland did a very extensive study that showed that 50% of people were asymptomatic. And just 2 days ago, an article was released in a peer-reviewed publication. It was done out of Stanford, and it showed that the community that Stanford University is in, which is in Santa Clara County, had 50 to 85% times the number of people with the virus. In other words, asymptomatic transmission is incredibly effective. And the only way we can prevent that asymptomatic transmission of virus is if people cover their mouths with a handkerchief or a cloth or a surgical mask when they go outside. That mask prevents the virus from leaving your mouth. It's incredibly effective in catching about 90 to 100% of the spittle that comes out of your mouth when you talk. And essentially that's where the virus lives. So wearing masks is the second most important tool that we have in our toolbox for conquering this virus.
Second to
social distancing.
Yeah. As a germaphobe, when we talk about how we spread germs and how this thing gets around, it's kind of hard for me to argue against wearing a mask all the time.
Right. And I suspect that society will change in that we will start seeing people wearing masks, much like what we saw happened in Asia after the first SARS virus in 2002, 2003. Now it's very common in Asia to wear masks, and I have a feeling we're going to see something like that here in the U.S. as well.
Well, even the tradition of wearing masks in Japan, for example, is not that unusual. I mean, there's such close quarters that the culture has such respect for each other that they will wear masks so they don't get somebody else sick. I wish we thought a little bit more that way.
That's exactly right. And the other thing too, when you look at Asian cultures, there's also a lot of non-touching, right? So there's a lot of bowing, for example, when seeing each other. And I think that a large part of that was also because, like you said, in Asia, especially in Japan, where you have a small landmass with a lot of people, I think people inherently saw early on that wearing masks and not touching one another in a greeting decreased the likelihood of transmission of viruses and or bacteria.
I wonder if we really start wearing masks in great numbers, if it's going to cut down on the sale of breath mints.
I think it probably will. And in fact, one thing I will give you a little tip with wearing a mask, this is what I do, is I find that when I wear a mask, and this is just Dr. Dery's opinion, there's no study on this at all whatsoever, but I chew gum when I wear a mask. And what I find is that when I chew gum, when I wear a mask, I breathe out of my nose. And so the mask doesn't get kind of grimy with the inside of my mouth spittle kind of on the inside of that mask. I'm not breathing out of my mouth, I'm breathing out of my nose. So the mask, if I'm wearing it for the day because I'm out and about, because I'm not necessarily, I'm an essential worker, so I have to be out and about. So when I wear a mask all day, by the end of the day, it's, it's been on my mouth all day. So, but I find that wearing that gum forces me to breathe out of my nose, and it preserves the length of the mask.
And this is a common problem, and it happens with me because I wear glasses, but sometimes your glasses fog up. Is there anything we can do about that?
Yeah, again, chewing the gum helps with that as well.
Okay. Doctor, since you're one of the ones on the front line, what's the scariest thing you've seen so far?
Well, I mean, in terms of the virus, is that how quickly, so the virus really affects people differently. And so the asymptomatic people, let's just move them aside. These are the folks that have like a little cold, or they have a little, or they feel nothing at all, right? But the people who it does affect, and probably there's some genetic predisposition why that may be the case, is that in some of those people, they get very, very sick very, very rapidly. And oftentimes it's very difficult to manage treatment because we really don't have treatments right now. There's lots and lots of studies that are happening to try to find which treatment may be effective. And I'm sure you've been hearing about some of those treatments, but as of right now, we don't really have treatment. And the virus doesn't act like a regular viral pneumonia usually acts. In some people, it doesn't act like that at all. And so what we're seeing is that my intensivist colleagues, or my pulmonologist colleagues, these are the ones that manage the ventilator, are having to change the way that they think about things with respect to treating this like a regular viral pneumonia. So it's really quite fascinating.
Doctor, we hear about testing and tests being available, and this is one of the keys to reopening the economy. Explain to me what that means and what that's going to look like. Who's going to be tested, and how is that going to open the gate for the different phases?
Sure. So this is such an important question, Scoot, and it's one that's going to evolve over time. So the hard thing about this is trying to explain this in a manner that's straightforward, and it's not because it requires a little bit of understanding of immunology. So I'm going to take you back to like medical school 101 for a quick second. So there's two types of tests that we're talking about. There's one test that tests directly for the virus, and those are the ones that you saw where people put the swab in their nose, and that's called a PCR test. And what that actually is looking for is active virus. You're actually a person who has that has the COVID-19 virus, and you're shedding that virus, and you use a PCR test for that. Those tests are incredibly important, and we need 3 times, 5 times the number of those tests than we have already, because we need to be able to find those people who are positive. So we need to test them. We need to trace them. So we need to do contact tracing to find out who they were in touch with and get to those people so that we can isolate all the positives. So that's going to be the next big step moving forward. And I refer to that as test, trace, and isolate. So, but the question you're asking me is about really it's this new tests that are coming out that are called antibody testing. And what that is antibodies are proteins in your body. They're kind of like the soldiers of the immune system. They're the ones that fight infection. So whenever there's an infection, you rely on your antibodies to fight that infection. And that's essentially what vaccines do. Vaccines provide you with antibodies, ahead of time. So if you get the flu shot every year around October, November, and then you're exposed to the flu in February, you already have those antibodies built. So those antibodies can go and fight that flu infection. What we're seeing here with the COVID-19 virus is something in that we're going to be able to start testing people for antibodies in their blood. It's a little finger prick, like if you're taking a little blood sugar or something. They prick your finger, you put it on a test. It looks like it's like a rapid pregnancy test. You get the results back in about 10 or 15 minutes. And it tells you if you've been exposed to that virus in the past, because you'll find evidence of antibodies. And the only way that you have these antibodies is if you've been exposed to this virus in the past. So that's what you've been reading. They've been talking about passport to immunity and this sort of stuff. But if we can get as many people positive for antibodies, that means that there's more and more people that have what's called herd immunity. And this is one of those ways that we're going to be able to open up the economy. The thing is, though, is that without a vaccine, it's very, very slow. And it's going to take years for people to get that virus to produce those antibodies. The only way you can do it rapidly is through a vaccine, but we're still a long ways away from that. Now, Sweden is doing something very interesting in which they're not closing down. And it's the people like myself are very concerned. They're trying to do something where they're trying to get as many people as exposed as possible so that they generate herd immunity very quickly. I don't think any public health practitioner would recommend that, but it's certainly interesting to see the Swedish experience to see what happens over time with them. I anticipate that they're going to probably get that spike in that curve, and that may overwhelm their public health or their hospital system or healthcare system. But that's essentially what they're doing with the tests, is they're trying to determine who has antibodies and who can get back to work.
Well, who's going to be tested? And like, am I going to be tested? Am I going to be tested at work? Am I going to be tested at a doctor's appointment?
So there's no recommendations for this as of right now. I was just reading this morning in the papers that there's over 70 plus manufacturers who've applied for the test, who have produced the test, and they've applied for FDA approval. Only 4 people. 4 of those manufacturers have actually gotten an FDA approval. So you're going to have you're going to see a lot of the streets flooded with these antibody tests, quite literally. If it were me, I would personally advocate for all first-line workers or frontline workers to be tested. So this way, physicians, nurses, people who are truly on the front line, the grocery clerks, the RTA drivers, what have you, they can get tested. And if they're positive, they would feel a lot more comfortable going back to work and feeling comfortable. And if they were negative, then those were the folks that would be continue to be sequestered so that they would not be at risk for getting the virus.
Okay. What is the biggest mistake people are making now in terms of their actions and understanding of COVID-19?
I think that people still don't understand the importance of staying indoors and wearing masks when they go outside. I just don't think that that it has really, that there's a true understanding of how potentially dangerous this virus is. Now, I'm going to walk those comments back a little bit and recognize that I am being somewhat contradictory here, because I did talk about that Stanford study that showed that there was this huge amount of asymptomatic transmission. So it means 50 to 85% they had to increase their active cases by 50 to 85 times. I mean, that's a huge amount of people who did not know they got the virus and they did fine. So I'm having to walk this tightrope here of really still trying to get people to understand the importance of staying indoors, because even though we're now seeing that asymptomatic transmission is so incredibly common, more common than we had ever thought, we still need to stay indoors, because we don't know who those people are that could get potentially very, very sick and then ultimately overwhelm the healthcare system. Because what we're trying to do is, by flattening that curve, what we're doing is we're spreading out the time that it's going to take for that infection to transmit through the community. People are going to still get the virus. They're going to still transmit the virus. They could either do it all at once, like they're going to do it in Sweden, or they could do it over a longer period of time. And so I am fearful that people don't understand that. They're like, listen, it's asymptomatic transmission anyway. Who cares? I'm going to still go out. I want to live my life. I want to be outdoors. I want to do this, that, or whatever. And what I think people aren't realizing is that when people stay indoors, they are helping to save the lives of all the first line workers. They're helping to save the lives of people who do go to the hospital, because what we don't want to see is a run on mechanical ventilators. We don't want to see a run on the PPEs. We don't want to see doctors and nurses getting sick. So it's super important for people to continue to stay home and to wear masks when they go outside.
When we talk about social distancing and understanding, it seems as if there is this attempt by some in the media to push this idea that this is all BS and we got to get the economy going, and it's important to do that right now, and let's just open everything up. And there have been protests to that cause. What do you say to them?
Yeah, I just completely disagree. I take the perspective that without people, you don't have an economy. And if you open the economy too quickly, what's going to happen is we're going to see a lot of people get ill very, very rapidly, and we're going to overwhelm the healthcare system. I just think that they're wrong. I'm the sort of person that puts people in front of economy, and there's other people who put economy in front of people, and that's fine. That's just a difference of opinion, I suppose. But we can't fix people if they're sick and they die, but we can fix an economy. We've done it after World War I. We've done it after World War II. I think that we are incredibly, as a nation, we're very smart. We're very good at what we do, and the people who are in charge of economies and policy will be able to recreate an economy that has been as successful as we've seen after World War I and after we've seen with World War II. We have evidence that we can do it. We did it after the Great Depression. We can definitely do it again, but it has to be done in a manner when the public health workers and the experts say it's time, and it can't be rushed. If it's rushed, we're going to end up being back where we are now.
Now, we've heard the argument from many, including the president, that the shutting down the economy, the solution may be worse than the effects from the problem.
Yeah, it's hard for me to, he uses the word cure there, and there is no cure for the disease. I respectfully disagree with our president. I think that, again, it depends. When you're a hammer, everything looks like a nail. And from, the economist perspective and from global world leaders, from their perspective, economies are what is what makes society run. And I completely understand that. But again, I take the perspective where I trust and I know that we will have a thriving economy again, but we need to take care of this problem first. It's like if you get sick, I'm sure you've been sick in the past, Scoot, and maybe you were like, I really need to go out and run this errand or whatever, and you know that you should probably stay in bed, but you got out and you ran that errand anyway, and then you come home and you're like, oh, I shouldn't have done that. I feel worse now. And then you do another day or two in bed, and you're like, I shouldn't have exerted myself like that. That's the same, individual example of what could happen on a larger societal level if we do that, if that example makes sense.
Dr. Dery, things got better because of social distancing, because enough people did take this seriously. And so we were not overwhelmed in terms of our hospital system and healthcare workers. We didn't need as many ventilators as predicted. Isn't it possible that we can still, through our adjusted behavior, that we can still change things to where it doesn't turn out to be as bad as predicted?
So of course that's a great question, and there is I couldn't give you an answer like I've been, every answer I've given you up to now has been based, strongly on science and research and all the reading I've been doing. So you're asking an excellent question, Scoot, and I don't really have a very good answer for you. I understand the basis of the question. I understand that people do want to do some modified, and perhaps there is, but I just don't think that we're at that point soon. I think what you're describing is some sort of gradual reentry back into society. And I think that that's likely to happen under very specific conditions. But I just don't think that we're there quite yet. I think we need to see like 100% of people wearing masks outdoors or some sort of face coverings. I think that we need to see a much better job of people just continue to remain indoors, go outside for a walk or a run like I do every day. I do a 5-mile run, what have you, but that's the time outside. But until we get to a point where we are really good with staying indoors and wearing masks, I'm afraid if we even open the doors a little bit, that people are going to, just be mindful of how important it is for us to still consider that we're still in the midst of a pandemic.
But it sounds like you're predicting a time when the majority of us will be wearing masks if we end up going to a Saints game at some point, if we end up going to a concert.
Well, it's funny you should mention that. I mean, I think that, now you're asking me to take out a crystal ball, okay? So now that I've got my crystal ball out and I've smoothed it down and I rubbed it, here's what I think is going to happen. I think that I would like to see like middle seats being removed from airplanes, right? I would like to see that the seats at a Saints game be a little bit more spread out. I would like to see that we don't pack clubs as much as we used to in the past. And certainly the governor of California and late last week set out a bunch of guidelines, and very specific in those guidelines was when we reopen restaurants, there's going to be half the number of tables in the restaurants. The waiters are going to be wearing gloves and masks. Your menus are going to be disposable. And it's thinking through to levels of that level of detail is going to be incredibly important. And I suspect that we're going to see some element of that here in New Orleans. I think that for example, my wife and I went to go see Elton John at Jazz Fest, right? It was so crowded, like 6 or 7 years ago. It was so crowded. We were all the way in the back behind the porta potties, pressed up against the fence. That was how packed it was. And we were like, we can't do this anymore. It was ridiculous. I think that those days, are going to be gone for a very, very long time.
Now, I know you're not an economist, but that conceivably would cause the price of everything to go up. I mean, if there's less capacity in a restaurant or on an airline, they're going to raise the prices to maintain the profits.
I suspect you're probably right about that. And again, I think that there are ways in an economy that can be repaired and offset, and prioritization needs to be. There needs to be prioritization to stuff like that, so that there isn't that offset of cost. Because I think that's a great point. But again, I think that at one point, the conversation that we're having here is prioritizing public health with prioritizing people's entertainment or love for food or celebration or what have you, or getting the economy running. I'm a public health practitioner, and so for me, my bias is always going to lean in the area of protecting public health.
But you're also a musician, and how long do you think it's going to be? Can you make a prediction about when you think you might be spanking that bass behind you?
I'm telling you, I had a regular gig from 1 to 3 o'clock on Sundays that we love to do, and it's we're recording it on the day that I should have been playing today. I don't know. I wonder what the music world and what New Orleans is going to look like after I think about it all the time. If and when we do open, are we going to start to see music? Like, am I going to get my regular gig back at the restaurant bar that we used to play every Sunday? I don't know. It may be gone. I suspect it may be. I think that there's going to be some sort of resetting. But it's such an important question, Scoot, that you're asking, in that what's the New Orleans culture going to look like in terms of getting people close together in a club? And I just don't see that happening for a long time. There was an incredibly important paper that was released in Science magazine last week that was published from an epidemiological team at Harvard. And it was in Science magazine, so peer-reviewed. It's an excellent article. And they're predicting that social isolation can continue as far into 2022 to as far as 2024. Now, it's probably not going to be quite as intense as it is here, but there is going to be a strong consciousness Christmas, of probably that we're going to be asking people to keep, spaces away from one another, that there is going to be some element of distancing. But this is going to probably be our norm until until a vaccine comes around, which, again, we don't know how long that's going to be.
And I'm thinking that this, like, in so many ways, changes the whole dating world.
I would imagine. I would imagine. I do click on those articles every once in a while when I see that, and I'm fortunate and privileged enough to be in isolation with my wife. But I do think about those individuals that are by themselves, or what have you, and certainly my heart breaks for those folks.
Yeah, Doctor, it's Sunday, April 20th, 2020, April 19th. April 19th. What? That's 20th. April 20th. 19th? I think it's the 19th. These days run together. They do. When I don't if I don't have church to go to on Sunday morning, it doesn't distinguish the day for me. And then reading and going to the station doesn't distinguish the day for me. So whatever the date, here we are. What is it that you can say that will make people feel optimistic about the immediate and long-range future?
That we have a great understanding, and we will have a better understanding as we move forward as to how this virus will work. 4 months ago, this virus was not even on anybody's radar. And now, as you can tell, this is the only thing that anybody's talking about. So we've learned so much about it moving forward. And so the things that I would like to be able to say is that please continue to be patient. We will resume a life. Again, it probably will be a little bit different than what we're used to, but life will continue to occur post COVID-19. That a majority of people who do get the virus are asymptomatic. It's only a minority of people. And when I say only a minority, for those people, that's their lives. So we still need to be respectful for that. I would ask that people continue to exercise and continue to do the things that they enjoy as we continue to be in this state of social isolation. But the best news, again, is that we have learned as not only as a medical community here in New Orleans or in Louisiana or in the country, but around the world, there's been a tremendous amount of understanding of this virus that we have. I think that should this happen again, for example, if we get a COVID-22, for example, that we will be in a much better position to protect ourselves than we are here. The other thing I want to say too is that it's incredibly important for us to recognize how we need to have a much more robust public health infrastructure. And I think that coming out of this as well is that we will see a lot more effort and energies and monies put into public health infrastructure, so that, again, if something like this were to happen again, we would be very ready for it. And I would have you look at the Asian countries, like how quickly South Korea was able to establish their testing, or how quickly China was, or how quickly Singapore was. They were right there on it. And so I see that as being potentially good news that would come out of this as well.
From a sociological, cultural standpoint, it seems like this is going to change our population in general. It's going to change our culture. You admitted to me in our first conversation that you too are a germaphobe. I have ramped up what I do, but I can't say that my life is that different. I'm fine without shaking hands. I'm fine without that, but I was okay with doing that. I just wouldn't touch anything before I wash my hands. In fact, I always had the menu. If anybody had gone to dinner with me, they know that right after I touch the menu, I've got to go wash my hands, because I know other people have touched the menu. But don't you see some of these things becoming like regular habits for Americans?
I really do. And that's another really piece of good news that comes out of it. I, like you, do not like shaking hands. I will fist bump and elbow pump all along the way whenever possible. Those are always the things. And my friends and family laugh at me, because as soon as I order off of the menu, I get up and wash my hands as well when I'm at a restaurant. And I get teased about it all the time, but all the people that tease me about it aren't teasing me anymore about it. And here's another thing. I'm going to double down on another one for you, Skip. So whenever my wife and I, or a friend or whatever, if we're responsible for getting the birthday cake for somebody's birthday, I'll always get a cake, and then I'll get like a little cupcake and I put the candle on the cupcake.
I've thought about that.
And so but I will never eat from a cake that somebody has blown candles on.
I know.
I look at that happening in my head. I can just see the spray of spittle all over that cake. And I've long ago stopped eating cake that somebody blows on. So I'll always bring a little cupcake, and they can blow the candle out there, and then that leaves the cake. So that one is the one that I hope people really recognize.
That is a brilliant idea. Is there anything you want to add before we let you go? You've been so insightful. I think we might want to get together with you again. I'm going to share some of this on my radio show at WWL, AM/FM, and radio.com. And just the way you put things and your vivid explanation of things is very, very helpful.
Thank you. I just want to warn people against complacency in that even though as these days kind of slog on and they get longer and they get more difficult, that it's important for us to think collectively and as a community and recognize that the heroes in this fight against the virus are beyond the physicians and the nurses, but the grocery clerks and the bus drivers and all the other people that are also on the front line. And so it's so important for us to protect them. And the way we can protect them is by wearing masks when we're outside, continuing to stay indoors, very, very aggressive hand washing. And I also want people to recognize that moving forward, the only way that we're going to continue to bring that curve down is, again, through that test, trace, and isolate. So I'm starting to ask people to if they do go outside, that they start writing down or start recognizing where it is that they're going, because if they do come down with a positive, they will get a phone call from public health practitioners that will ask where they were so that they can start doing more robust contact tracing. And so those are a couple things that I would also recommend, if it's possible for people, to get digital thermometers and blood pressure cuffs, peak flow meters or pulse oximeters, so that this way, if they do get sick, when they call the doctor for a telemedicine visit, that they'll be able to give them that sort of information that will be helpful for us to make our minds as to what to do.
When I think about our capitalist society, I think about going back to the origin of masks were worn in Mardi Gras because classes could not come together, and by putting on a mask, you couldn't tell their origin, you couldn't tell the rich from the poor. I'm thinking about the masks, though. Will we get to the point where there will be some distinction because there'll be a Louis Vuitton, Michael Kors, there'll be a Gucci mask?
Yeah, I see that as well. I'm trying to get a mask that says something like, "This mask protects you from me." Start having messaging on here. Like, yeah. I've seen masks with smiles on them, but yes, I anticipate that, and maybe around Mardi Gras we'll have masks with Mardi Gras themed.
Speaking of that, is it possible we'll have Mardi Gras next year?
I read an article this morning, interestingly enough, in the Daily Mail, which was crazy. Why would a UK? But it was somebody who came down from Mardi Gras this year and was trying to make the argument that, boy, oh boy, Mardi Gras next year is going to be a blast. I think that Mardi Gras is going to be different, again, in kind of the same way. I don't know. It's hard for me to predict if we will have a Mardi Gras next year. But given that this, science article said that we may be socially distancing to 2022 minimum, if we do have a Mardi Gras, I suspect that there's going to be, the crowds will be a lot less, that there will be a lot more social distancing. There will be a lot more masks being worn, a lot more hand washing. It's hard to say at this point what that will look like. And as we get closer, it'll be interesting to kind of then have that conversation with the public health officials.
Dr. MarkAlain Dery, thank you. You're a specialist in infectious diseases, and you have helped me, and I know you've helped a lot of us a lot. So I appreciate your time. Thank you.
Thanks, Scoot. I appreciate it.
Thanks for watching. If you liked the video, make sure to like and subscribe and hit that bell for all notifications from radio.com. While you're at it, why don't you check out some of our other great videos.